All right, let's dive right into one of the toughest areas in nursing, neurologic disorders. You know, these things can strike in an instant or creep up silently over years. And for a nurse, being able to recognize what's happening in time, well, it isn't just important, it is absolutely critical.
And that really gets to the heart of it, doesn't it? The stakes are just incredibly high. I mean, if you get this right, you save lives, you preserve function. But if you get it wrong, the consequences can be truly devastating.
So that's exactly what we're going to preview right now. The CSMRN framework. That stands for Clinical Sense-Making for Registered Nurses. It's all about a system that's designed to cut right through all that confusion, to build that clinical reasoning you need for your exams and, more importantly, for your practice.
Let's just call it what it is. It's a giant neuro puzzle. And we have all been there, right? Staring at a long list of neurologic disorders that just start to blur together. It feels like this high-stakes game where you're missing half the pieces.
And you know, as students, we all grapple with the same stuff, right? How do you tell if something's acute versus chronic? What are those super subtle early warning signs that you just can't miss? What is going to harm my patient right now? And the big one, how in the world do I take all this textbook stuff and actually use it to answer those tricky exam questions?
So, does this sound like you? You've got the names memorized, Alzheimer's, stroke, ALS, check. But then an exam question hits you with a scenario and asks you to prioritize, and you just freeze. If that feels familiar, trust me, you are not alone. And the good news is there is a much, much better way to approach this. And this right here is where the CSMRN approach starts to completely change the game. It's not about more memorization. It's about a system that takes all that chaos and sorts it into clear, manageable categories.
Okay, so look at this. This is where things start to click. We stop looking at these disorders as just some random list we have to memorize. We actually categorize them. Stroke? That's an acute event. Guillain-Barré? It's acute, but it's autoimmune. Then you've got your progressive disorders, and we even break those down by what they primarily affect: motor, cognitive, or genetic. This one simple step, just sorting them, is the foundation for thinking like an expert.
So let's put it to the test, right now. A patient comes in with sudden weakness on one side of their body and their speech is slurred. Just looking at our new categories, which type of disorder screams for immediate, right now intervention?
Exactly. The framework just lights up. It points you directly to an acute event. The priority becomes crystal clear. This is a possible stroke, and we all know that time is brain. See, you're already thinking 2 steps ahead, all because you sorted the information first.
So sorting is step one, but the real magic is how that translates directly to action. Once you know the category, the framework basically gives you a roadmap to your priority interventions.
And this just lays it out so perfectly. The type of disorder tells you where to focus. For Guillain-Barré, that acute autoimmune issue, your eyes are glued to their breathing. For an acute stroke, you're thinking about reperfusion. For the slow cognitive decline of Alzheimer's, your whole world is about safety. And for those progressive motor diseases, you pivot to neuroprotection and rehab. It's beautiful.
Okay, let's try another one. Your patient has Guillain-Barré syndrome. They tell you the weakness in their legs is moving up, and it's moving fast. What is the number one, don't pass go, absolute top priority you have to deal with?
Airway and breathing. Every single time. The CSMRN guide is so explicit about this because with Guillain-Barré, that ascending paralysis can hit the diaphragm. The framework trains you to, and I'm quoting here, monitor the patient for signs of respiratory failure because they may require intubation. You see that? The framework connects the disease process directly to a potential life-saving action.
So what have we actually been doing this whole time? We've been using a formula without even putting a name to it. Let's break down what that is. This is it. This is the secret sauce, the core formula. It's a simple, powerful 3-step process. First, you identify the type. Is it acute or progressive? Second, you interpret the deficits. Are we talking motor or cognitive problems? And third, based on that, you prioritize your actions to stop the worst from happening. This is the engine that will drive all of your clinical reasoning.
And isn't that the whole point? It's about moving beyond just flipping through flashcards and becoming a clinician who can make smart, confident, and safe decisions, especially when the pressure is on.
You know, this really leads us to the biggest takeaway of the whole CSMRN approach. It is a fundamental shift in how you learn this material.
Let me be really clear about this. CSMRN isn't designed to just dump a longer list of facts into your brain to memorize. No, it's about training your brain to see the patterns, to anticipate the risks, and to act decisively before a small problem spirals into a catastrophe. And this is why it matters so much. Because whether you are facing a computer screen during an exam or you're standing at the bedside of a real patient, this one skill, the ability to recognize and act quickly, is what protects your patient's function, their future, and their quality of life.
Look, what we've just walked through, that's really just a taste of this method. The complete, in-depth framework is waiting for you inside. So I guess the only question left is, are you ready to stop memorizing and start reasoning?